Good evening and welcome to another glorious day and another episode of Dr. Melissa Medicine Woman. I am so grateful that you have joined me this evening to learn more about what you can do to help your body, how you can heal and get to the root cause of the problem, eliminating medications, optimizing the amount of supplements that you're taking, looking at ways to make you feel better. Integrative practice is what I like to call it. So tonight we are going to be talking about more than just rubbing it down. What? I'm going to be talking about massage and how that is definitely part of integrative medicine. So let me tell you a little bit about tonight. I do have a disclaimer to read to you as a healthcare professional. So let me go ahead and pop that up for you. This show and all the content are for educational purposes only, not intended to treat, diagnose, cure, or prevent a disease or psychological disorder. A specific physician-patient or pharmacist-patient relationship is necessary before any medical therapies are initiated. Please consult your physician, pharmacist, or other qualified healthcare provider with questions about your medical conditions and before starting or using any dietary supplement, herbal remedy, exercise, or nutrition plans. So, who is Dr. Melissa? Well, Dr. Melissa, I am an Eastern and Western medicine concierge pharmacist. I am the root cause doctor. I am considered a de-prescriber by my physician friends, especially. And I have over 26 years of experience. So that's why you should listen. I have knowledge to help you. I've been through circumstances. I have helped thousands and thousands of patients and clients better their health, feel better, live longer, less stress, less headaches, less medications, and they're actually able to be vibrant and live how they want to live. They're healthy. They're doing so well. So I want to get into how this massage is going to work tonight. So I do want to talk about how it can actually help you to take charge of your health and your well-being by getting a massage. So massages used to be thought of as luxury. You could only find them in luxury spas, maybe some upscale health clubs, but today you can find them almost anywhere. They are offered at businesses, clinics, hospitals. You even see them in airports. So what is a massage? It is more than just a little rub down. So there's pros and cons to massage. And I just came from one. And so I was inspired to actually bring this forward to you today. So I pushed aside what else I had and I thought, you know what? I'm going to talk about massage tonight because I just came from a great massage. And that is something that can help you with your health. So massage is very relaxing. It can also be medically necessary. It can be ordered by your physician sometimes. Some work comp cases use massage therapy. I was actually talking with my massage therapist about how she is a medical massage provider. And that means that she has met the proper certification. She has the proper license to work on you and be able to bill for medical massage. So medical massage is something that's ordered by your physician. It can be ordered from like work comp cases. So if you're injured on the job, injured in an accident, sometimes that's helpful. So massage can help you in many different ways. So let's talk about what it really is, okay? So massage is generally It's the pressing, it's the rubbing, it's the manipulation of your skin, your muscles, your tendons, and your ligaments. So your massage therapist goes to school and learns about the body. Okay, so they have to learn about all of these processes. They have to learn about the muscles. They have to learn about the ligaments and the tendons, and they learn about your skin in order to do these types of massages. So massages can range for anywhere from light stroking to deep pressure. There are various different techniques and types. And so depending upon which type you're looking for, could be a provider may be able to do that for you, and you may be referred to a different licensed massage therapist. The most common massage is a Swedish massage. Now, a Swedish massage, this is like a gentle form of massage. It uses usually long strokes, some kneading, maybe some circular movement, some vibration, tapping, and it helps you to really feel relaxed and energized. And so when you're there, this is kind of the one where it's just, you're there just to relax, enjoy, work out some kinks you might have, maybe in your neck, maybe in your back. It's a very relaxing massage, and it's that usually that lighter touch. Now, when we get into deeper massage or deep tissue massage, that's usually when they go a little bit deeper. So more forceful strokes. So they're targeting and they're getting into those deep layers of the muscles and the connective tissue. And it's very common to use like a deep tissue massage to help with muscle damage from injuries. So if you've been in an accident and you have some muscle damage, we get in there and your massage therapist is able to dig a little bit deeper into those muscles. So sometimes it's a little bit painful to start with as they're working out those kinks or they're working out into those deeper muscle tissues. So sometimes it takes a little, you might be a little sore after that. Now, if the pressure is too much, be sure and speak up. Don't just let them do something if it's not comfortable for you. So I have an area, I have a knot sometimes in my neck that comes and goes based upon how my stress level is doing. And so we work through that knot, and there's times where it's really good and sometimes where it's a little tougher. And so she has to work a little bit harder to get that. And I have to breathe and relax and release that emotion that I'm carrying there and just let it go, because that is one benefit that massage can help you relax and release that tension. Now, another common type of massage you may have heard of is a sports massage. So sports massage is very, very similar to the traditional Swedish massage. It's, however, targeted towards people who are in sports, okay? And it's used to help prevent or to treat injuries, okay? My husband went to physical therapy for his knee not very long ago, and they actually did some massage on the knee to help with those muscles that hadn't been used for a while because of the injury. So they were able to help those muscles and massage them out. And as he was doing his physical therapy, because he's using those muscles more again. So we wanted to prevent any further injury. Now, trigger point. Okay. This is kind of a specific massage. It usually focuses on the tight muscle fibers, usually after an injury or an overuse of that particular muscle. So if you need to have trigger point massage, it's probably because you really have overused that muscle, and we need to get in there and release the the connective tissue in there. There's things that can be done like myofascial release. So myofascial release is a form of massage, which goes and it helps to release that connectivity issue. So if you think of a chicken, and you think of that white film that's on the chicken breast when you pull it out, that is the myofascial tissue. And the myofascial tissue, it connects your different muscles together. And if you're utilizing your muscles and you're exercising your muscles routinely, then your myofascial, your fascia is usually able to be released a little bit easier. Now, if you're not utilizing that muscle, it may take some work to release that fascia. Okay, so myofascial release is a type of massage as well that you can go in and it helps to pull back like that chicken skin, that white film, to release it and allow your muscles to move more freely. Okay, so those are some different types of massages. And you're saying, well, why is the medicine woman talking about massage? Because this, as I said earlier, taking charge of your health. Massage is a very great way. It's an integrative, non-pharmacological treatment that is used for various reasons. And well, let's talk about those benefits. Okay, so the benefits of massage have been shown to reduce stress. Yes, when you are stressed, tension, and you have a massage, it can help you release that stress, reduce your stress, and help with increasing your relaxation because you're laying there, you're listening to some calming music, or maybe it's quiet if you prefer it quiet. And you're relaxing, you're breathing normally, and you're allowing yourself to have that time to reduce the stress. A number of pharmacists were polled. And what was the number one thing that they did to reduce their stress? Go get a massage. Just a traditional Swedish massage? Yes, that is exactly right. Reducing your stress by having an outlet, having a massage, a time for you to relax. So take time to do that for yourself. Massage can also reduce pain. We talked about targeting specific muscles. If you have an injury, especially, massage can help with that, depending upon what type of injury. So talk it over with your massage therapist, and we'll get into a little bit more details about that in just a minute. But they can help with the pain. They help with muscle soreness and tension. So a massage can help reduce that tension, reduce that soreness. So just like my husband with his physical therapy, he hadn't been utilizing those muscles because of the injury. And now he's working those muscles more and more because of the therapy, the physical therapy, but we didn't want to overexert them. So he was in a little bit of pain after using them, those muscles that he hadn't used for so long. So a little massage was able to help calm those muscles down and alleviate some of that pain. Massage has also been shown to benefit you by improving your circulation. It can help improve your energy and your alertness as well. So how does it do that? So it stimulates. So as the rubbing of the skin and the muscles, it can help improve that circulation because it's stimulation, okay? As I said earlier, it can help you to relax. Well, relaxation can help lower your heart rate, lower your blood pressure, and that's benefit because we've talked about in the past so many things that can lead to heart disease and issues with blood pressure and heart rate. So keeping it lower and in a good range, massage can help with that. Massage can actually even improve your immune function. What? That's right. Yes, it can help improve your immune function. So with massage, especially regular massage, it's keeping your muscles and your tendons and your ligaments, it's keeping them in a good, relaxed state. It's utilizing, so they're expanding and they're contracting, and it's actually helping to stimulate and help improve your immune system because your body is functioning at a nice, relaxed state, which helps improve your immune system. Now, there has been some additional research on specific things. And so I'm going to list these, that this is the research that I found. There's articles to show that also specific conditions such as anxiety can be reduced by massage therapy. Some digestive disorders can be improved by massage therapy. Fibromyalgia, which is a condition that's painful, massage has been shown that it can help with that. Headaches. If you're frequently getting headaches and you don't want to be stuck with taking a pill all the time to help with those headaches, maybe you're using another alternative, maybe you're using oils or something else, but something is you need a little additional. Massage can help with those headaches. Massage has been shown to help with insomnia, especially related to stress, because as we said earlier, massage helps to reduce stress. Pain, low back pain specifically. A lot of people in the United States, over 90% of the population when polled, has some form of back pain. And we'll have a whole discussion on that soon. So stay tuned for that. Nerve pain. Nerve pain can be helped with massage. Injuries, we talked a little bit about that earlier. Upper back and neck pain. As I talked earlier, I carry a lot of tension in my shoulders depending on my stress level. And I do a lot of things to help reduce that stress. And massage happens to be one of them. It's part of my self-care. It's part of my integrative medicine approach that I use for my own self, having a massage. Now, those were some specific conditions and diseases that we did talk about. And the biggest thing is, I would say, it helps to reduce the pain, helps to reduce the stress. It helps you to feel comfort. Okay. People who have gone through massage often feel caring because they go through that massage. They take time to care for themselves. Now, massage is part of the integrative approach. Okay. So it's one of the options to use. Now, of course, depending upon what you're going in for massage for, make sure that you do give your massage therapist a history. And I'll talk just a little bit more about that in just a minute, of what they'll ask for and why, what to expect. Okay. Now, there are some instances where massage may not be appropriate for you at this time. And that could be that if you have a particular bleeding disorder or you're taking blood thinners. Okay. Now, this is just something you need to talk over with your massage therapist, talk over with your pharmacist, maybe even your physician, and find out what are the risks, what are the benefits for you specifically. Because blood thinners thin your blood, and we want to make sure that we don't thin your blood too much, and some stimulation of the skin could cause that. It could also depend upon how thick or thin your skin is. That rubbing could cause it where you could bruise easier. if you're on a blood thinner. So those are some things to consider. Now, if you have open wounds or you have burns, then that is not appropriate to have a massage at that point or on that area of your skin. You need to keep that area clean. Don't rub it. You want to make sure that, especially if burns or wounds, that you allow them to heal. They are not meant to be massaged at that point. If you have a DVT, a deep vein thrombosis, then we don't want to be massaging that area because we don't want that clot to move. We want to give your body time to heal, and your body will go in and eat that clot away. Now, there is medication that helps to keep you protected, so to speak, from that clot, helping it to stay and allow it to dissolve. There's medication, usually blood thinners, that we put you on if you have a clot like that, so that we can give your body time to dissolve it. Sometimes we need to dissolve that clot with particular things as well. Now, if you're sick, don't go get a massage. You don't want to pass that infection on to your therapist, and that is not the best time to go and do that. If you have a broken bone, well, it's probably not going to be massaged. That's not appropriate at the time. Let your body heal, and then massage therapy could be part of your healing treatment, but initial broken bones, not good. Platelet counts. So if you have a very, very low platelet count, which is like severe thrombocytopenia, then massage may not be the most appropriate thing for you. Okay. Now, here's a couple other things. If you are pregnant, it doesn't mean you can't get a massage. You need to go to a massage therapist who specializes in that type of massage, because we're not going to lay you on your stomach. There's different ways that you can still get a massage, because pregnancy, of course, you're carrying the baby, which is extra weight on your body, which could be putting fatigue on your muscles. So a massage could be very beneficial, but making sure you're going to somebody who specializes in pregnancy massages. Now, if you have cancer, this is something you need to discuss with your massage therapist and your physician or your pharmacist to figure out, okay, depending upon where you are in your cancer journey, could determine as to when a massage may be appropriate or may not be appropriate. Just because you have cancer does not mean you can't get a massage, but there are certain times, depending upon your treatment, where it may not be the best thing for you at that time. Okay, so, excuse me. As we talked a little bit earlier, some massages, depending upon the pressure, could leave you a little sore. Now, if the pressure is too much for you, speak up. Tell them to ease up on the pressure. Usually they'll ask you, how's the pressure, how's the touch? And if it's good, that's good. If you want a little bit harder, then let them know that. But sometimes when they do go deeper, especially, you might notice that you have a little bit of soreness, especially the next day after your massage. So just keep that in mind. And then we can talk about that. We can do some stretches to help with that soreness. Okay. We can do some alternative heat or ice therapy. And I know we've talked about that in the past. Now, so when you go in, and if you've never, ever had a massage before, take the risk. If it's appropriate for you, you don't have a contraindication, and go experience it. They're going to have you fill out some paperwork. You're going to fill out some paperwork, and you're going to give them what your symptoms are. If you're having particular pain in a certain area, then they usually have a chart for you to mark, and you're going to mark, I'm having pain right here, so that they can focus on that particular thing, especially if you're going in for a medical massage. You know, your physician has ordered it because of particular, either it's a work comp case or a particular condition. It's point out the areas that is in pain at that point. Fill out your medical history. Let them know of the different types of medications that you're taking, the different conditions that you have, because those conditions can make a difference. We went over some of them that may not be the best choice for a massage. Now, if you're diabetic or have high blood pressure, those are questions your massage therapist is going to ask you. Those things don't mean that you can't have a massage, but what they need to know is they need to know you have those conditions. And if you are diabetic, make sure that you eat before your massage, because as your body relaxes, your blood sugar is going to drop. Okay. And we don't want you to drop too low. If you have high blood pressure, then your blood pressure could drop during the massage because of the relaxation. So check your pressure, know what's going on with yourself. And if anything, if you feel different, or make sure you speak up and tell your massage therapist. Now, if you've never been in for one, usually you lay on a table, you have a sheet draped over you, you undress to your comfort level. Okay. And then they will peel back the sheet for the area that they're working on. If they're working on your right leg, that's the only thing that's going to be exposed at the time. They're very professional. Okay. Now, some massage therapists, or most massage therapists, will use some sort of oil or lotion to help with the friction, to help their hands slide up and be able to do those strokes. Now, if you're allergic to anything, be sure you notify them and put that on your sheet ahead of time, because if you're allergic to a lotion or to an oil, you want to make sure they don't use that on you, because then that could be worse for you. You could have a reaction, you could break out in a rash. That's not good. So make sure you let them know. Now, massages can also take place in a chair. So chair massages are common. I've done health fairs where chair massages have been available, and you sit in a chair, basically you sit forward into the chair, and so they're massaging your back and your neck for anywhere from 10 to 15, maybe 20 minutes on a chair massage. A full massage takes usually longer, anywhere from 30 to 90 minutes typically. So just explore it. You know, if you've never done it before, start with a 10-minute one, start with a 15, 30-minute one, so that you can experience what you are aiming to experience, reducing your stress, taking charge of your health, and using this integrative medicine as part of your therapy. Okay, so how do you find a massage therapist? Well, most of the time you ask for recommendations. You have a friend or a family member who's gone. They'll let you know if there's a good one. Look online, look at the reviews, look to see how well they've been reviewed. So look for a 5-star review, look to see somebody that you're searching for. Okay, there's different techniques, there's different styles out there, there's different pressure. Some people like a little bit more pressure, some people like light pressure. So find one that works for you. Try a coupon. Groupon often has a lot of massage therapists. So you can go and you can try one out and see if that's the right one for you. If not, try somebody else. Okay. So I want you to learn from this that massage is definitely a very key, vital piece of integrative medicine. It is a very powerful tool that you can use to help you take charge of your health. And as I said earlier, as the root cause doctor, sometimes we need to get to the root of the problem. And massage is one way that we might be able to utilize to get to the root of the problem, to help release that tension, to release that fascia, if that's what the case is, to allow those muscles to breathe. Okay, so check it out, see if massage is right for you. remember, you want to take care of yourself. You only get one life, one body. Take care of it now so that you can run around, have the energy to chase your children, to chase your grandchildren, to spend time with them and be vibrant in your life. So I have a special just for you watching today. And if you'll go to, let me pull it up for you. The next steps for you, specifically for you, go to my website, drmelissabalizan.com/TV. So DrMeLissabalizan.com/TV. So I have a special just for you watching, okay, that you can go on in there and be sure and take advantage of that free offer just for you watching TV tonight. It has been a pleasure. Thank you all for joining me. I am so grateful that you have joined me. Take care of yourself. Take charge of your health. You only get one life. So this is Dr. Melissa, the Medicine Woman. Have a wonderful, healthy day.